Birth control or contraception is necessary in everyone's reproductive life. You are recently married and you wanted to have a spacing before you plan for your child, or you are a single woman and wanted to have an intercourse with your partner but do not want to have a child, or you have already a baby and you want to space the next pregnancy after a certain duration, then you need to have a proper contraception plan or the birth control plan for yourself and for your partner. So there are many contraceptive methods which are there in the market. You have barrier contraception, which you have a mechanical barrier between bodily fluids exchange, that is the female and the male bodily fluids exchange, that is which prevents the sperm from reaching the egg and then so prevent the pregnancy. Second is the pills which are used to prevent the pregnancy even after the bodily fluid exchange has happened or an intercourse has happened. Third is a mechanical device which is inserted into the uterus of the female so that a pregnancy can be prevented. Nowadays a few more plans have come, like an implanon and all. These are the implants which are inserted into the skin of a female, where it regulates the different hormones in the female to prevent the pregnancy from happening. Okay, now let us talk about birth control pills or contraceptive pills or no baby pills. So these birth control pills are of two types. One is a combined oral contraceptive pill and the second one is mini pill. Combined oral contraceptive pill consists of two hormones. One is estrogen and other is progesterone. Whereas mini pills has only a progesterone hormone which is used in lower doses to prevent the pregnancy. So let us see these act and how does these affect the women's health to prevent the pregnancy. Before getting to know how these hormones act, let us see the normal hormonal balance in the uterus and how the pregnancy happens. This is the image of a uterus. This is the vagina. This is the cervix, that is the entry point into the uterus. This is the uterus. This is the cavity of the uterus. The yellow layer here is the endometrium, pink is the myometrium, and the upper yellow layer is the serosa. These are the tubes and these are the ovaries. Now, every month two hormones are helpful in regulating the menstrual cycle, that is estrogen and progesterone. These are secreted in certain amounts to prepare the uterus for the upcoming pregnancy. So in the due course of time, in the first 15 days of a regular cycle, this estrogen and progesterone are increased in size. Those two hormones prepare the inner lining, that is the endometrium. It thickens to its level, and when the pregnancy does not happen or the fertilization does not happen, the hormones fall in their amount. When the estrogen and progesterone levels fall and this endometrium gets damaged and died, and this sheds outside as periods or the menstrual bleed. So now what happens? What are we doing with these birth control pills? These birth control pills have estrogen and progesterone in a certain amount so that this endometrium is kept thinned for a period of time so that the pregnancy does not happen. What are the different modes of action of these birth control pills, of this combined oral contraceptive pills? Is first, it increases the thickness of the cervical mucus. When the cervical mucus gets thickened, it prevents the sperms from entering into the fallopian tube for fertilization. Second is it thins the endometrium. So even if a fertilized zygote comes for implantation in the cavity, it is not receptive. Third one, it does not allow the ovulation to happen. This is the main function of these oral contraceptive pills, that if the egg is not released, or it turns the cycle into an ovulatory cycles. When the egg is not released, even if the sperms enter, the fertilization cannot happen. So this is the mode of action of oral contraceptive pills. So can everybody take oral contraceptive pills, or are there somebody who should not take oral contraceptive pills? So there are few people who cannot take oral contraceptive pills. That is the reason before you start on a birth control pill, you have to consult your gynecologist, see that you are an eligible candidate to take the birth control pills. So if you are obese and you have a BMI more than 30, you have a heart disease, or you have a chronic liver disease, or you have a tendency to form clots in the legs frequently, you have migraine, and all these factors, if you are having it, you are not eligible to take a birth control pill. Doctor has prescribed you, yes, you are an eligible candidate to take the birth control pill. Then how do you take it? Now these are different birth control pills available in the market, and so I have taken one to show you how we do it. So now you get a period on a particular day. That day is considered as day 1 of your period. Whatever day is your first day of period, and even if it is Monday, Sunday, Monday, Tuesday, or whatever it is, and the days are written in this. So if at all you get your period on a Monday, you start from the starting of this packet on a Monday and follow the arrow. And every day you need to take the pill at a particular time, and you are not supposed to miss the tablet any time. So you follow the arrow, and so that you will not miss any pill, and follow it for 21 days. There are 21 pills in this sachet. So what if I miss a pill? One day you miss a pill, then you remember it in the evening, you take that pill and continue your pill taking the next day regularly. If you have missed your pill for consecutively for 2 days, then you need to continue the pill from the next day continuously from there on, and for the next 1 week you need to use an additional barrier contraceptive. And if an unprotected sexual intercourse happens from the immediate 7 days, then you need to protect yourself from a pregnancy happening by using an emergency contraceptive. You have 21 pills in this sachet, so you use the pills for 21 days and you stop there. And usually the next period starts from around 3 to 4 days after your last pill. If it does not happen up to the 7 days from your last pill, you need to take a fresh sachet and start your contraceptive pills again for the next cycle. So if at all your periods start on the 3rd or 4th day after stopping your last pill, then from the day 1 onwards you will start another fresh sachet to continue your contraception in the next cycle.